Good afternoon. It's a great pleasure to present the preliminary result of shotgun sequencing analysis from the refresh study. My name is Alba Talavera, and I am a pre-doc student bioinformatician at Ramón y Cajal Hospital in Madrid. In the last year, our group has been interested in approaches to manipulate the gut microbiota in HIV infection as an approach to prove causal association between the microbiome and the immune system and to attenuate chronic immune defects linked with the development of comorbidities. With this aim, we designed this randomized placebo-controlled clinical trial in which we include HIV-infected individuals with a suboptimal immune recovery during suppressive ART, as reflected by CD4-CTH ratio below 1, who received 8 courses of FMT during 8 weeks using frozen encapsulated stool or placebo capsules. No antibiotic preconditioning was used. Also, patients were not excluded in case of prior antibiotics use. We collected feces and fecal samples throughout the weeks of treatment, as well after up to 10 months after its completion in order to have a post-treatment follow-up. For this analysis, we evaluate the change from baseline at the time point highlighted in red here, in all subjects in the FMT arm and in 8 subjects in the placebo arm. Donor screening and FMT preparation was done at OpenBiome. Based on the knowledge about the HIV-associated microbiome at the time of the study design, we select 3 out of 500 donors based with a top abundance of Fecalibacterium, Bacteroides, butyrate, and low Prevotella. In relation to the study cohort selection, 29 participants complete the 48-week follow-up. We previously published the Illumina 16 rRNA sequencing analysis, in which the weekly variation in each arm were described in detail, where we reported that fecal microbiota transplantation is safe and well tolerated, not related to severe adverse event, and attenuates HIV-associated dysbiosis. Now we report on the preliminary shotgun sequencing result to further explore more deeply at the species level. The steps followed over the study were DNA sequencing by shotgun methods, quality control followed by a trimming and subsampling of the sample reads. For the taxonomic assignment, we used Kraken2 combined with Bracken, which used the Kraken output to develop a Bayesian estimation of abundance. We measured variation in the microbiota composition using alpha and beta diversity metrics, and also used linear discriminant analysis effect size to determine the species most likely to explain difference between classes. And here are the results that we found. This bar plot shows how taxonomic composition of the top 15 most abundant species change over the weeks in each patient, grouped according to the treatment received. The donor's microbiota was dominated by species belonging to Bacteroides, Fecalibacterium, Intestinomonas, Leptospiraceae, Roseburia, and Clostridioides genus with a marked heterogeny profile. We can observe the alpha diversity variation over weeks for each FMT and placebo arm. At alpha diversity levels, FMT was associated with a significant increase in Shannon index in the FMT group, in contrast to that found in the placebo group. The beta diversity variation were also calculated using the Bray-curtis dissimilarity between each subject with the assigned donor separated by FMT and placebo arm. In this plot, we can observe that trajectories indicated a modest engraftment of donor's microbiota in the FMT arm, which appear to be donor-dependent when we represent the same data grouped by donor. A greater effect is seen in donor A. And also, the engraftment could have been enhanced by previous antibiotic use, as suggested when we separate the plot according to the previous antibiotics. Since we had a placebo arm, we can explore to what extent the changes were stochastic. So we perform a left-side analysis to identify taxa significantly changing from baseline to each time point in each arm. Here we observe the FMT arm result. We can see 99 bacterial biomarkers were identified at week 7 and 117 taxa were still driving difference at week 8 in FMT arm, in contrast with the placebo arm where we only observed 37 differential abundant species at week 7. Left results showed that the number of species inserted over time in the FMT group was significantly higher than in the placebo group. Another informative way to look at this result is by mapping the LDA distance from baseline to the different time points together to the abundance in donor samples as a notation at the left side of the heat maps. Is a single heat map split in 3 parts in order to facilitate the visualization. In the placebo arm, we detected some new taxa across study visits, so this heat map essentially represents the stochastic variation in the microbiota. In clear contrast, we detected engraftment of several taxa in the FMT arm. There is a clear cluster that stands out in red, where we can see that there is a list of bacteria that were the most robustly engraftment over time, which is composed of fermenting bacteria and producing butyrate and acetate. To conclude, repeated oral capsular FMT from rationally selected donors was safe in HIV-infected subjects on ART and introduced incremental compositional change in the fecal microbiota at the species level. Our results indicate that manipulating the gut microbiota using a non-invasive and safe strategy of FMT delivery is feasible. We are now addressing the change in fungal communities, impacted pathways, and engraftment at the strain level. I would like to end by thanking my entire team and all the people who have participated in this project. And of course, many thanks to all of you for listening to me. Thank you.